patient today in the hospital. This is Dayton, and his last name is
Downing.
Downey. And you're going to help me hold my stethoscope. Can you do that? Have you ever seen one of these? Yes, in the hospital, right? Dayton is 2 years old, and he would be just like a little peanut that you'd see anywhere. We need a, right there. I know, it's just right there. I can't reach it.
Oh, tourniquet.
Usually what I do with little people like this is I just talk to them at first. And I want to not have my back to the camera. So I try to show them all the equipment I'm going to use so that they're not scared. And Dayton doesn't know me from Adam. And so he's very interested in my stethoscope, which is good. I have little things on here for him to play with. And I'm just going to show him all the equipment I'm going to use before I start putting gloves on or trying to scare him in any way. So I want to show you everything I'm going to use to practice with you today, okay? Alrighty? He looks a little bit scared. Can you show me on your hand how old you are, Dayton?
3,
This many?
2.
Good. Sometimes I show them the equipment before I'm going to use it, and then I actually already have it set up right beside me so that when I get down to doing it, I have everything already. I already have my my T-connector primed. I already have my needle open. I already have everything already, but I'm going to show him what this tourniquet looks like so he can see. Do you see this rubber band, Dayton? Have you ever seen one of these before?
Yes.
You have? Good. It looks like a rubber band and it feels like a rubber band. See how tight it is? Oh, I see. And this is a little towel that I'm going to wash her arm with. Oh, you're so sweet. And this is a little piece, it holds soap. And I'm going to clean your hand with this. And all I'm going to do is just demonstrate how you can get a child to let you do it. If you promise them it doesn't hurt. This part doesn't hurt. Just listen really carefully. Oh my goodness, did you hear that make a pop sound? And now it's got soap right there. So I'm going to put my soap right back in here. And I'm going to look at your arm for a second. Ooh, you have big muscles. Oh my goodness. All I'm going to do is put this rubber band on your arm. He's got very good hand ones. And actually his antecubital probably are good too because he's nice and hydrated. Not always will you have a child, if they're coming in to get an IV started, have very good veins. So you have to go for the closer ones to his heart and not worry about the hand ones initially because you probably would just be sticking and giving them a poke that would hurt. Now Dayton, I'm going to squeeze this on your arm for a second. It feels kind of tight. Does that feel tight? Just a little bit? It doesn't really hurt, but it sure does feel tight. And I'm just going to feel right here. Ooh, you have big old vessels. He's got very nice vessels here. And see, he's okay with that. Now I'm going to take it off, just like this. And I'm going to put it right there. And then I'm just going to take you through the procedure. I'm just going to clean it off with my soap, just like this. And you guys have to pretend I have gloves on. See how I'm cleaning it? Ooh, does that hurt? It does. I'm sorry. I'm sorry. And then I have to take my little towel and wipe it off, just like that. Dry it off. Then I'm going to put my tourniquet right back on, just like this. And if I were going to start an IV on Dayton, I'd put my gloves on right now. And I would tell him, you know, have you ever been pinched like this, Dayton? Does that kind of hurt? Ow. Just a little bit? Well, that's what this would feel like. I would get someone to help me for demonstration purposes. I will take this off his arm. I would get someone to help me. And if they were my helper, it could be the mom, it could be the dad, it could be another nurse. But how you would want to help is set them up like this. Some kids do better if you lay them flat. Some kids do better if grandma or mom are right here beside them and they're holding them. Just like this, but not in their lap, because sometimes grandmas and moms move a little bit, and that makes the child nervous. So if they're holding just like Donna is right here, that helps him from setting forward, and that helps him not jerk when I'm doing that. Someone else could be on this side and hold his arm right underneath like this, and most kids, adults are the same way. They'll twist their arms like this when you're sticking. So if you can already have his arm the way you want it when he's going to twist it, and just hold it like this, then you'll be able to feel. You could get someone to hold behind like that, and you could hold down here and hold his hand and stick like so. There's a lot of different ways to do it. Or the person helping you hold his arm could hold back here and hold here at the same time, and then you have the whole area free to do that. Until you get used to doing kids, you probably need another person to help you. It's a very hard thing to do by yourself. With these little ones, they're kind of like our elderly patients. They don't have very big vessels. So you kind of, I'm not going to take this out so I don't scare Dayton, but you want to go at a very small angle, probably about a 15 to 20 is what the book says, not a 45, and definitely not intradermally. You want to go initially with the poke, with bevel side up of your catheter at an angle like this, and then you can level it out and go forward. You don't need to tell them it's not going to hurt. You need to tell them that it will hurt. It'll be a little pinch, and they'll give you the same reaction he just did. I'm not going to hurt you today, Dayton, okay? I'm just telling them if I were going to start a little IV on you, it would, but it's not going to right now. And see, they would do that, and most sick children that are in the hospital for an IV really won't move that much if they're really, really sick. And they might move a little bit, and that's why you get the mom and dad's help. If mom and dad don't want to help, just get another nurse. And letting them hold something in their hand will help it seem a lot less harsh to them. Giving them something that they can keep, whether it be a sticker, a toy, a book, something that would be useful for them later on, are all good things to let them have. And then telling them how good of a job that they did, and that you really think that they're brave and they're strong for helping you. And that always makes them feel better. And then reassure the parents that they did a good job. And if you have to poke them more than once, most hospitals will let you poke them twice. You notice I'm trying to say words that aren't scary for him. I'm trying not to use the word needle. I'm trying not to use the word shot. I'm trying to just use the words poke, and this is how you would get your medicine, kind of things like that. Because they're very, very smart, and they listen to everything you're saying, especially when they're sitting in a hospital bed and they know something's up. So tell them like it is. Inform mommy of everything that you're going to do, and dad, and make sure that you have the right parents. Sometimes the mom and the dad of the child, the biological parents, are not the guardians of the child. It might be the grandmother, it might be the aunt, it might be the stepmother. So make sure you're talking to the right person to give information to. And maybe he calls his grandmother mom, because that's all he's ever known. So make sure that you get the right person with the right job, and that's helpful too. He's a cute little redhead. I'm trying to think. Then you're going to document what size of catheter you use. Mostly the catheters you would use for pediatric patients would be a 24 gauge and a 22 gauge. 22 gauge you do use on adult patients and teens, but on a little boy like him today, I would use a 22 gauge because it's got a bigger bevel size and a bigger catheter size, because he's not really dehydrated. But if I looked at the little vessels in his hand, and those are what the anticubitals look like, I wouldn't use any more than a 24 gauge. We don't use heparin to lock these if there's no fluids going through. We only use saline, and that's a policy at all the hospitals now, so we don't overdose kids on heparin. The only time you would use heparin on an IV line for a child would be a central line, and that's usually arterial, or if the physicians put in a femoral line, an umbilical catheter for neonate, or a central line somewhere, brachial sometimes. I've never seen a jugular on a child. Usually they've got these big brachial and femoral and umbilical for the neonates. So if they put in a central line like that, yes, it would have a hep lock, not a saline lock. When you put yours in like this, and you only want to use it to give them fluids or to draw lab work sometimes, then you would just put saline in it. Just your normal saline that you get out of your Pyxis, or you can draw up your own if you don't have these fancy little saline syringes already pre-filled for you. You do use the Tegaderm just like you do the adults. Most people on a child will put a chevron over the chevron taping over the Tegaderm, and I'll show you how to do that in a minute. And inside these little kits, you have a little gauze drape. I don't usually use those on kids because of the noise. Some kids are afraid of that noise that the paper makes, and they're not sure about it. So I usually just use a towel, because they know what a towel is, and they know about baths and keeping clean, and that's a little friendlier to them. He doesn't seem to be worried with the paper, so he probably colors a lot, and is very smart and bright, and does a lot of things with different things around him. So he's a typical boy and doesn't really care about anything in the environment too badly unless it looks like it's going to hurt him. But thank you so much for helping us today, Dakota. And all those students that are watching this are really, really happy that you were a big boy and helped us out with this presentation. So thank you very much.
You're welcome.
You want to get up now? And I'll show them how to do it on a mannequin. There's